In this episode, I talk with Dr. Aviva Romm about all things energy, from adrenal fatigue to thyroid balance, from signs of burnout to adaptogens to nourish your body. We talk about endometriosis, fibroids, cysts, and excess estrogen in women today, along with simple remedies for balancing the entire endocrine system, connecting the dots between your adrenals, thyroid, and ovaries. Welcome to the Flower Lounge, a place for conversations with wildly creative people and a little plant-loving wisdom to help you experience life in full bloom. I'm Katie Hess, flower alchemist and founder of LOTUSWEI, and I believe in a world where we're all living at our personal edge. I love interviewing doctors that not only have an education in natural medicine, but who make it their lifestyle. Dr. Aviva Romm became a midwife and herbalist in her teens, and it wasn't until she had delivered hundreds of babies that she decided to go to med school to become an MD. She shares instances when the medical system, historically and even still today, fails women and how passionate she is about integrating natural and allopathic medicine. If you look at her Instagram page, you see that herbs are a way of life for her and she walks her talk. So Aviva, thank you so much for making the time to be with us on the Flower Lounge.
Oh, it's such a pleasure.
I think your story is so interesting, how you started first as a midwife and an herbalist, and you did that for 25 years before you even thought about going to med school. And before we just dive into all the really meaty topics, I wondered if you wanted to just talk a little bit about how that shaped you as a person, how that shaped you as a doctor, how that shaped sort of your body of work.
Yeah. So I actually had thought about going to med school before I became a midwife and an herbalist. Got off that path. I got on that path when I was 15 and then kind of made a left turn into midwifery and herbal medicine at 16, really started studying and practicing. And I think it's informed everything that I do. One, when I look at the history of how women have been treated systematically, historically, for hundreds of years, if not thousands of years, and the continuity that we have as a legacy in the biases that we see in medicine now, I wouldn't have known that had I gone straight to medical school. It's not part of the medical education, at least not in an overt way. Tacitly, it's a big part of the medical education, but I wouldn't have known to be aware of that and to not let myself, get educated in that way and to see things a totally different way. So just from a historical perspective, it's been enormous for me. Another thing that both the herbal and the midwifery piece, but especially the herbal piece, offer me is always remembering that there are gentler ways to approach most conditions. And even if pharmaceuticals or surgery become part of them, that's not usually the best first entry point. So how can I think more broadly? And it's a really big ecological perspective for me. It's not just the impact of pharmaceutical overuse on our personal physical health. There's a huge impact of pharmaceutical use that's happening ecologically to our planet that then, of course, does come back around to our physical health. So that awareness informs how little prescribing I do and how I keep prescribing to, when necessary, the smallest amounts of the safest pharmaceuticals I can use, and often am able to not use them. And then I would say the third piece that's really central for me is that midwifery literally translates as with woman. And the idea of midwifery is that a woman's body is inherently capable of pregnancy, birth. Our bodies have an inherent and an innate wisdom. And conventional medicine is so much more about overriding that wisdom or ignoring that wisdom or denying that wisdom. And I see conventional medicine almost as technically it was based on assembly line models of care. Modern hospitals, I jokingly say disassembly, but it's not that funny really, because it's kind of what they are. But so that has kept me centered in not being the physician as the center of the universe or my patient's care, but my patient being the center of her universe and the relationship that we have with each other, and really tuning into what her needs are, what's going on in her life. So I've kept that woman-centered model as part of everything I do.
Well, let's just start with what you talked about as your first one in terms of medical bias against women.
Mm-hmm.
Where do you see that? I mean, I think, so just to give you some reference, I have been operating in my own business, running a small 10-person team of folks working with flower essences. And I have been living in a pink bubble for like 20 years. I don't see Western doctors. The only MDs I see are my close friends who happen to be MDs. I'm, heavily reliant on traditional Chinese medicine, and I haven't seen a doctor in like, I don't know how many years. So school me on what is happening today.
Yeah.
And what the historical roots are, and just sort of like where you're seeing that pop up today in the US.
Yeah. So an article actually just came out recently in the past few weeks looking at this actual measurable microaggression against women. And so what happened was a group of researchers identified and videoed actual intentional behaviors that were done to women, dismissing them, discounting what they were saying as their symptoms, overtly being verbally abusive, essentially. And then what was interesting was that these videos were shown to medical doctors. And the next layer that's really fascinating is that the male medical doctors almost universally didn't recognize that that behavior was inappropriate. Whereas more women doctors, not all, but more women doctors were able to say, something's happening here that's not okay. Another example is this just came out in the medical news feed that I get just today. There was a conference for physicians who specialize in airway management. So like if you have a horrible accident and you need to get, like you see it on Grey's Anatomy or medical TV shows, like they get trached, right? They intubate someone. There was this conference on that. And there was a physician who was teaching the audience his special technique on inserting the scope or the tube to intubate someone. And he said something to the effect of like, it's kind of like finding a woman's G-spot, and made some really inappropriate, lewd comments to which a lot of the audience actually laughed, and then subsequently showed the next slide, which was how to position a person's neck. And it was an image from some thriller of a woman being choked by a man. And it was supposed to be a joke. And the thing is that quite a number of the audience reacted and said, this is inappropriate, something needs to be done. But a substantial number, the majority of the audience actually found it funny and laughed. And the fact that it could even happen says so much about a culture that has historically had its roots in a level of marginalization of women, biased against women, and overt abuse of women. But just one example that's really famous is a physician who considered the father of modern gynecology and obstetrics. And the last name was Sims. And he was known to have operated on slave women, sometimes the same slave woman 10, 14 times with absolutely no anesthesia. So very, almost like the horrors that you would imagine of the concentration camp. And yet he could still be considered in our modern medical world, that he can still be described as the father of modern obstetrics. So there's this very intense bias that's based in a long historical chain of how conventional medicine has evolved as a profession. And then within that, there are millions of examples hundreds of examples of medical conditions that demonstrate overt bias against women. Just for example, well into the 1980s, women with migraines were considered frigid, or were women who didn't accept their social role appropriately. Endometriosis.
Sorry, that's just
I know, it's terrible. Endometriosis, long into the time that I've been practicing, was considered a disease of modern career women. So like the conflict between your life and your hormones and your biological role as a mom would have caused this medical problem. And the list goes on. I mean, this is on and on. How it's showing up for women now is in a wide variety of ways. I mentioned migraine. Migraine pain, along with most women's pain, is significantly dismissed. And it's even more dismissed if you're a woman of color. So for Black women with pain, a great example would be Serena Williams, who has a known blood clotting disorder, had a baby, was in the hospital having chest pain and difficulty breathing, which is a sign of blood clots in her lungs, and was told that she was anxious and should just calm down and then give her something for her anxiety, when in fact, had she not been Serena Williams and aggressively been an activist for her care, she very realistically could have died from that, and she needed appropriate treatment. Pain left and right is treated differently in women. So a woman in the hospital who starts having symptoms of a heart attack is more likely to die from that heart attack in the hospital than a man, because a man is more likely to get an appropriate cardiac workup. A woman is more likely to be told she's anxious, stressed, or tired, and to be given a sedative or anti-anxiety medication. And so she doesn't get the workup. This goes on and on and on. We see
and
it
this is
in...
still happening today.
Yes, there was a study that came out just a couple of years ago that showed that women who have chronic pain, if they go to the doctor and the doctor perceives them as a more attractive woman, they're less likely to get treated for their pain because they're seen as, well, if she has time to put on her lipstick and do her hair, she couldn't be in that much pain. Conversely, in the same study, it was found that a woman who goes into the medical doctor's office because she has pain, seeking pain medication, who is trying to get help for her pain, if she's just feeling crappy or just likes to wear sweatpants and doesn't wash her hair and do it every day and doesn't put on makeup, if she shows up with the appearance of being less attractive or not put together, she's more likely to be treated as a drug addict who's seeking pain medication. So women are actually trying to figure out, well, how do I go to the doctors? Like, what do I wear? How do I appear? How do I present myself? So this is happening day in and day out. It happens in medical offices. It happens in hospitals. It happens in clinics where women are treated differently. We see this in studies where women have gone in for ovarian pain because they're having an ovarian rupture, being told, oh, it's probably just your period. Or a woman going in for an ectopic pregnancy that's rupturing, which is, I've seen women in this kind of pain. It's excruciating, being asked, are you sure you're not just on that time of the month? It's so rampant. I mean, even the fact that doctors are judging women based on attractive or not, right? There's a lot of fat shaming that's happening in medicine. So women who are overweight are being told things like, oh, as one of my patients who turned out to have Hashimoto's, which was causing her metabolism to slow down, had gained 30 pounds in like 3 months, went to her doctor and her doctor told her, well, if you would just control your fork to mouth problem, you'd probably lose the weight.
Oof, that hurts.
Yeah. So there's so many examples. We could spend a day just
when you
on those.
Went to med school, I know you had kids at the time.
Yep.
You were thoroughly schooled in receiving babies and believing in women's bodies and listening to women and knowing yourself how to get babies. And did you personally experience anything that was just sort of like a difference in worlds when you entered med school, or was it pretty much just exactly as you expected?
You know, it's interesting. I remember first being a very young woman studying midwifery. I was 16 and I got a copy of one of the home birth kind of movement books. And I remember thinking, there's no way this could be true. This has to be completely negative propaganda. And, you know, what I would say is that there are so many wonderful people who go into medicine and become physicians, and they have great altruism and great caring, tremendous compassion for their patients, tremendous respect for women. It's not usually the individual doctors. There's something tacit in the system that is predicated on this dominator model in which women are at the bottom of the totem pole to be dominated. And so I saw many microaggressions when I was in the hospital, and some pretty overt ones. One of the ones that comes to mind most specifically is there was a woman who had preeclampsia. So this is a very severe, potentially life-threatening for the mom and the baby. And she had to be put on a medication called magnesium sulfate. It's an IV. And you know how magnesium is relaxing for your muscles, right? Well, magnesium sulfate basically renders you kind of immobile. Women describe it as feeling like, I have lead in my muscles. I just can't move. And I was actually sitting in the corner of the room writing this woman's chart. And it was very dark in the room. She was asleep and I was just taking some notes. She had gone to sleep. A nurse came in the room and didn't see me in the corner of the room. She didn't turn the light on. She put on a glove, pulled back the covers, and was about to do a vaginal exam. I said, what are you doing? She said, I'm going to do a vaginal exam. I said, you're not asking permission. She's asleep and she's immobile. So that's not okay. And she's like, oh, we do this all the time. I said, you know, that meets the definition of sexual assault. You're actually doing a vaginal exam on a woman who's not conscious and can't say whether she wants that or not. And I actually said, she kind of gave me some more pushback. And I'm like, that was one of those times you could play the doctor card, but she stopped. The mom woke up. She was horrified when she realized what was happening. And again, this nurse wasn't a bad person. She didn't think she was doing something wrong. This is just how the system operates. So I saw a lot of that. I saw a situation in which a woman who was African-American, had HIV, had a lot of horrible social situation. I think that the way the team saw her was somehow maybe less than competent to make her own decisions, which she was absolutely not. She was fully capable of making her own decisions. And she was having some trouble in labor, and they decided to rupture her membranes, break her bag of waters. But the baby's head was really, really high, and there's a risk of causing what's called a cord prolapse. And nobody asked her permission. Somebody went in the room, broke her bag of waters, just did it, said they were doing a vaginal exam, used a little tool that broke the bag of waters, and the woman had a massive umbilical cord prolapse and had to be rushed with someone's hand in her vagina, holding the baby's head off the cord to the operating table to have an emergency C-section. So yeah, I've seen a lot of crazy stuff. And the thing is too, sometimes when you're in medical training, you're not easily in a position to say something. So I tried to intervene anytime I could. In that situation, I was on the team that was having the conversation. I was like, this is totally not okay. You can't do this. But I wasn't her doctor. And her doctor still went in and did it. And that situation happened. I said, look, this is a recipe for a major cord prolapse. So there's a lot of bullying behavior, which is why there's so much depression and anxiety amongst physicians, and particularly badly amongst women physicians who are more apt to be sensitive to it and see it. But there's also a really big difficulty of people in training to do anything about it. It's not like if you get fired, you can just go get another job. If you lose your position in medical training, you're done. So it really creates this situation of kind of endemic silence. And a lot of women were not taught to speak up. And maybe in the moment we feel like we can't because we've got a medical situation going on and we feel really vulnerable. But most women, when they've experienced something like that, don't inform the practitioner later. They don't say, hey, this wasn't okay with me. So the behavior doesn't get changed because it doesn't get caught. The woman festers this feeling of being mistreated, but the system doesn't change. So I'm a big advocate for really crafting thoughtful. They don't have to be accusatory letters. Again, usually it's not that the doctor is a bad person. It's usually quite the contrary, but they're trained in a system that is dehumanizing and over-medicalizing. So I'm a really big advocate for people to, at some point, when the emotion can rest a little bit, write out everything that really happened to you and discharge that, like put that on paper so you can take it out of your body in a way, and then think through what you really want to say. Maybe that's not the letter that goes to the person, but maybe then you craft a letter that says, this happened to me and this was my experience. And I think it's really important for you to know how this left me feeling, how this maybe affected my physical well-being, and that this is not something that women appreciate, and that maybe this is something you're not aware of, but it needs to change for other women.
That's great advice. And I know you're just finishing up in the last chapter of another book. So are you operating would you consider that you're operating within the system or without this, outside of the system right now?
Oh, I'm way outside of the system. Outside. I have my own practice. I have to interface with the system, of course, but no, I feel like I'm a midwife who happens to have a medical degree and medical training, which is a wonderful thing to have. But yeah, I'm pretty outside the system. I maintain all my licensure and all my certifications. So in that sense, I'm in the system. But beyond that, no.
We were talking a little bit about pharmaceutical use, and I always think, I don't know what the exact statistic is. It's like one of the number one causes of Americans is properly prescribed medications.
Yes. Something like 63,000 deaths a year from proper use of properly prescribed medications in the US alone.
Phenomenal. How do you, in your private practice, and how does that differ from the system? You have a whole wealth of knowledge around herbs. I've looked at your blog posts. You've been doing this for a really long time. When do you typically prescribe pharmaceuticals, and is there a place for them in women's medicine? How do you feel about that?
Oh, yeah. Absolutely. I had a woman call me up just a couple of weeks ago with a raging kidney infection, and she was really sick, and raging kidney infections aren't as responsive to natural therapies. They can be really dangerous. So it was antibiotic time. Absolutely.
Yeah.
But if someone has mild urinary tract symptoms, it's like really early, they're not pregnant, there's no major risk factors, it's not a kidney infection, then I'll always go to a natural therapy first. So for me, I think about pharmaceuticals and prescribing in general, but also all medical interventions along 3 parameters. One is, what is the severity of the condition? And is it going to be something that's responsive and safe to treat with a natural therapy? Or do we really need to just go with a bigger kind of guns thing, if you will? And then I also think about the safety of the intervention. I always think, is there something safer, more gentle that can be used in this setting rather than a more aggressive, bigger side effect profile pharmaceutical or intervention? And then I think about, well, what does the human being in front of me want and need, right? So if someone comes to me and they have a situation where obviously they've had some physical trauma, they've fallen off of a ladder, or they've had a car accident, it's not going to be the time when we're going to talk about, would you like to use some arnica for that, right? It's going to be pretty obvious. In most cases, I mean, there may be people who have a religious preference that is different, but usually, that's pretty obvious. The problem with conventional medicine is that it kind of treats everything from the get-go, no matter how mild the symptom, with something that's usually more aggressive than necessary. So if it's very mild, then I will say, if you'd like, we can try this instead. And we can maybe use some butterbur and some vitamin B2, for riboflavin for your migraines instead of, a triptan drug. There's no medical risk to trying either. And then if something's kind of on the borderline, then I'll say, here are all the options and what is most philosophically consistent with what you would want to do in your life. So a good example of that would be a woman with a thyroid problem, right? She might have thyroid symptoms. She might have some significant symptoms. She may be like you or like me, someone who would prefer not to use pharmaceuticals unless it's really absolutely necessary. And her symptoms may be mild enough that she's functioning in her life and they're not posing a medical risk to her. In which case I'd say, here's the range of options. You get to pick. If there's some reason that I think that she's going to be safer using the pharmaceutical, then I'll always say that. But then it really becomes a conversation of what really works for you. Like, what's going to keep your sense of your self-concept intact? And for some people, especially people who err more on the natural side of things, using a pharmaceutical actually does really affect their sense of self. So it's all those 3 things. But absolutely, there's absolutely a place. I mean, even in as natural as I am, and I can tell you I've taken 1 antibiotic since I was 14 and I'm 53 years old, but I would always take one if I really needed one. It's, there are just other options, or I haven't gotten sick, thankfully, with something that required one. But let's look at hormone replacement therapy for women who are really struggling with menopausal symptoms. Perimenopause can cause such severe night sweats that a woman is just not getting sleep and she's horribly exhausted. And that can affect what she's eating the next day. It can cause her depression. She might have such severe vaginal dryness that she is having bleeding when she has sex, or pain, right? Like really affecting her life. So she may say to me, I'm not a person who uses hormones. There's no way I'm going to do that. And I'll say, great, here's all these other things. You can do this paced breathing. You can do essential oils, aromatherapy. You can do these herbs, these supplements, change your diet, this, that, and the other way. And that might be great for her. But if it's really affecting her life, or if she's someone who is very comfortable using those pharmaceuticals, I might say to her, you can use topical estrogen, and here's what we know about it, and here's how long it's pretty much safe for. The difference between me and maybe an average doctor would be, an average doctor is just throwing the hormones at everything. And there are like safe indications and there are ones that aren't. There's also an amount of time to be on them, an amount past where it's not. And a lot of doctors wouldn't know the other options. And so the only option the woman would get would be the pharmaceuticals.
It's so nice that you offer choices.
Yeah. And it's not even so much offering them. It's like, just how do I think of it? It's more like just making those available, saying, here's what's possible that you might not know about. And here are the pros and cons of all of them. It's really about educating women about them.
Okay, so we're educating the women. How far off do you think we are from educating the doctors? about?
It's happening in pockets. There are medical schools that, 30 years ago, the term integrative medicine didn't even exist. So things are shifting, and there are doctors who are recommending alternatives. They'll recommend acupuncture. There are doctors who know about herbs and supplements or diet. It's still very far and few between. And unfortunately, the conditions that women are most likely to be treated with medical bias about are often the ones that are the least responsive to conventional therapies. Doctors are likely to be the least educated about or take the least seriously. So fibromyalgia, for example, even though it's a well-recognized medical condition, now with a known physical cause, a lot of doctors still think it's an alternative diagnosis and don't take it seriously. So women get the eye roll, or they'll talk with another doctor about like, oh, that woman, she thinks she's got fibromyalgia. She's just, she just needs to get a life. And this is the kind of stuff that gets talked about when she actually has a real medical condition that's affecting her life. And there are things that she could do about it. Or it's really common for women to just get prescribed an antidepressant or an anti-anxiety medication for those physical symptoms. Oof. I know. It's changing. And what really causes the change is consumer demand. And this has really been the thrust of what has shifted conventional medicine, if anything has, in the past couple of decades, is patients saying, well, if I don't get it from my doctor, I'm actually going to pay out of pocket to go to someone else. And so a lot of what's been adapted or adopted into conventional medicine has been a response to that. And also more and more physicians are saying, well, I don't want to take that pharmaceutical. And they have their own experience with something alternative. And they're like, Eureka, that really works. And they get schooled on it and they change.
Right. You're right. We have an MD in our area. I live in Phoenix, who is recommending folks to come and take flower essences. So instead of getting on antidepressants and anti-anxiety medications, she's recommending flower essences. So helpful. So let's talk about thyroid and adrenals.
Yeah.
How would you know if you have adrenal issues or thyroid issues, and how are they related and linked?
Yeah. So thyroid issues, there are two basic flavors. There's hyperthyroid and there's hypothyroid. And there are also things like thyroid cancer. But I think when you're asking me, we're really talking about Hashimoto's. So there's Hashimoto's, which is the most common form of thyroid disease in the Western world. There's also Graves' disease. Hashimoto's is when your thyroid function slows down. Graves' disease is an autoimmune form where it speeds up. They're both autoimmune conditions. And those both have a pretty discrete set of symptoms. So with Hashimoto's, the most common symptoms are fatigue. And it's kind of like, it's not just, I'm a little tired. It's pretty, you notice something's different. Dry skin, constipation, thinning hair falling out, depression, anxiety, difficulty sleeping, weight gain, and especially weight gain when you haven't changed your exercise or your diet at all. It's just happening and you can't figure out why. There can also be things like fertility challenges, irregular menstrual cycles, heavy periods that go missing. So it can really affect women's gynecologic health. Hyperfunctioning thyroid actually is almost exactly the opposite. So instead of the constipation, you get loose stools. Instead of weight gain, you get weight loss, or you can eat an enormous amount. You can be ravenous and literally not gain a pound or still be losing weight. There are a lot of hyper symptoms, and it's much more a smaller percentage of the population that has that. Adrenal dysfunction, and we're not talking about adrenal disease like Addison's disease or something potentially life-threatening. We're talking about what happens when we're under too much stress, too much strain, either repeatedly or all the time. And what happens is your adrenals produce cortisol and adrenaline. And those are fantastic. Adrenaline makes us feel energized, excited. It gives us the feeling of surprise and enthusiasm in our life, anticipation. And cortisol is literally a life-saving hormone. You cannot live without cortisol. It boosts your immunity. It protects your blood sugar levels. It keeps you from dying from any infection that you might get. It does enormous numbers of things. The problem is that too much adrenaline and too much cortisol can actually have an impact on your body. Cortisol, it has a nickname called the wear and tear hormone. So over time, too much chronic exposure to adrenaline, for example, can make us feel anxious or tired and wired. Too much exposure to chronic adrenaline can cause high blood pressure and constricted heart blood vessels. Too much exposure to cortisol over time can cause weight gain, especially around the middle, depression, anxiety, changes in cognitive function. It can affect your willpower. It can cause high blood sugar. It can lead to immune dysregulation. And so what happens, a lot of people call this adrenal fatigue, but that's not really what's happening. What happens is in your brain, in all of your brain's wisdom, your brain says, I can't keep telling the adrenals to keep pumping this stuff out because it's actually harming her. So the brain just tells the adrenals to slow down, hit the brakes on production of too much adrenaline and too much cortisol. We also produce some adrenaline in our brain too. And so we get the opposite symptoms. Now we might not feel very enthusiastic. We might lose our drive. We might feel kind of down or depressed or unexcited. We might not be motivated. And then when our cortisol takes a hit, initially when we have that really high cortisol, we have all those symptoms I mentioned. But then when your cortisol gets the kibosh on it from your brain, then your immune system can start to tank. You might become more susceptible to a lot of different infections. You're burning on empty, and then you hit that first day of your vacation and all of a sudden you're down with the flu or strep throat. And that is often when autoimmune conditions start to show up. Now, the adrenals, the thyroid, and the ovaries are all very interactional with each other. So when your thyroid function takes a hit, that, as I mentioned, can cause a lot of gynecologic and hormonal problems, period problems, fertility problems, etc. The thyroid is what controls your body's metabolism. It creates your body's ability to burn energy. When your adrenals are producing, part of what's happening is they're doing that because the brain is giving your adrenals the message that you're in danger of some kind. When you're in danger, your body is going to try to get you to conserve energy. If you imagine an energy crisis, what do we do in an energy crisis? We turn down the thermostat to save energy. So in a sense, your adrenals are going to tell your thyroid to turn down the thermostat. So the adrenals have several direct ways. Cortisol can impact thyroid hormone production. It can tell your brain not to tell your thyroid to produce more thyroid hormone, and it can make your cells not receptive to thyroid function. So when we're under a lot of stress, that can be a big trigger for thyroid dysfunction. And then cortisol itself also directly can affect the ovaries and the uterus. So it can have a huge impact on our fertility, reproduction, and gynecologic health as well. So we're all so interrelated. And that's kind of, I think, a big difference of how I view human health and the body and women's experience of health. It's not compartmentalized. You can't say, oh, well, let me go to my endocrinologist for my thyroid problem. Let me go to my gynecologist for the fact that I'm skipping periods every month. And let me go to my psychiatrist or psychologist for the fact that I'm under stress. Even if you go to all those separate people, somebody needs to understand that it's all connected and help you see how. And that's a lot of what I do.
And how do you know? I mean, I suppose you just get tested, but how do women know, like, is it Epstein-Barr? Is it Lyme's? Is it a virus? Is it another autoimmune condition?
Yeah. So you basically look at the set of symptoms and then you kind of say common things being common. Is this likely? And, you look at all the things that can cause fatigue. It can be Hashimoto's. It can be non-Hashimoto's hypothyroidism, the non-autoimmune form. It can be Lyme. It can be reactivation or new Epstein-Barr virus. It can be an autoimmune condition. It can be diabetes. It can be depression. It can be just that you're tired and are a new mom or a mom running a business or whatever, all the things that we do, right? So looking under the hood at what the symptoms are and what the bigger picture is can help you determine what the proper testing is. So for example, if I have a patient who lives in New York City, who never goes hiking, doesn't go outside, and doesn't have a dog that goes outside, the chance of them having Lyme is extremely small. So I probably wouldn't have them spend the money to get Lyme testing. If they have no other symptoms of any other autoimmune disease, I probably wouldn't do a big workup for lupus and MS and everything. I would contain it to what, really looks obvious. But there are things like iron deficiency anemia. I had a patient who had been on thyroid medication for several years. She got put on it by an MD and she was still tired all the time. And when I looked at her lab work, somebody had seen Hashimoto's and not noticed the severe anemia. So even though the Hashimoto's got treated, the severe anemia didn't. She was still exhausted. She needed iron. She was also having really heavy periods, probably why she was anemic. So, looking at the big picture and not just getting stuck on one diagnosis. And that happens a lot in the alternative medicine world, right? You come in for fatigue, you have a certain set of symptoms and someone says, oh, it's adrenal fatigue. Let me put you on adaptogens. Or, oh, it's thyroid. Let me not even bother testing. Let me just put you on some thyroid medication. And we often miss the bigger picture that way. And it's not always only a pharmaceutical or, medical answer. But not doing another level of digging deeper. Yes, it may be Hashimoto's and it may be Lyme. It could be a couple of things going on.
And is that what you refer to as allostatic load?
Allostatic load. So allostasis is a term that means resilience within a constantly changing environment. Your body is constantly adapting to change that's happening internally and externally. So your blood pressure, your blood sugar, your stress response, this is all adapting to a whole number of factors. Allostatic load is when there are so many factors that overload your ability to be resilient and adapt anymore that it starts to actually impact your health. So for example, we all know what it's like to juggle a lot of balls in the air, right? Maybe you're a mom and you have a job and you still are the one who's doing the second shift when you come home from work. And you're trying to go to graduate school, and maybe you have parents that need taking care of too. This is very common for women. But we all also know, we're juggling these balls and someone tries to toss us the next one and we catch it and we drop everything because we're so overloaded, we're so exhausted, or we keep juggling more frantically and more frantically. That allostatic load is almost like the straw that breaks the camel's back. And so at some point you can't sustain it anymore. And when that happens, that's when we usually see signs. The first thing that we often notice is actually we start to use words that express how we're feeling. I'm very keyed into words as actually a medical symptom. So a lot of us will say things like, I'm really burnt out, or I'm at the end of my rope, or I'm running on fumes. And we kind of say it in a joke. And also in our culture, being busy is kind of a badge of honor. So we almost say it with like, I'm juggling all these things. But at some point, you can't indefinitely juggle and be everything for everyone. And so we start to pay the price. So I listen for these words in my patient as like, this is the first warning sign that she's heading down this path of overwhelm and burnout. And you may experience a sense of knowing that you're overwhelmed. And a lot of us push past that because we think we should be doing more, or we should be leaning in or doing everything or having everything at one time. Or we don't want to be weak, or, whatever it is, we just don't want to put any balls down. Maybe we have FOMO. We fear that if we put a ball down, we're going to miss an opportunity. Or we may be perfectionists, right? And we strive and strive and drive and drive. So I look for those words. Then I start to look for simple, kind of like everyday symptoms that often get dismissed as just normal human stuff, like not sleeping well. The fact that 40% of Americans are not sleeping well does not mean it's normal. It just means it's common. But it doesn't mean it's normal for our physiology. So I look at things like, is her weight changing and she's not doing anything that would change her weight? Is she losing weight? Is she gaining weight? Is she putting weight on around her middle, which is a common sign of cortisol? Is this person not able to fall asleep? Are they waking up in the middle of the night? Are they feeling more anxious or more depressed than usual? Like these things that are kind of just little biological or experience shifts. Are she having little aches and pains that she never used to have before? Is her focus or concentration off? And it can be men too. So then that's the next line of like, okay, we definitely need to do something about that because our bodies are brilliant, and the more we ignore the little messages, the more our body just screams at us louder and louder to take stock of what's going on. So as much as we can catch those little signs early, often we're in a great window to turn things around and reclaim that, both reclaim resilience, but also reclaim the right to have a healthy life, a balanced life.
And so for some of the listeners out there who are feeling like they're burning the candle at both ends and they're just really tired and holidays are coming and maybe now is the time to sort of revise, what would you recommend in terms of adaptogens for building and nourishing the body? And how would you choose the ones that you would want to work with?
Yeah. So first things first, of course, as we talked about, make sure there's not a medical something going on. Because often that's very resolvable. Even before I go to adaptogens, I usually ask people to do a very simple exercise, which is write down the 3 priorities that you have in your life, your personal priorities, your professional priorities. Like if you could distill those down to 3 things, what would they be? And then what in your life right now that you're doing is consistent with those and what isn't? And how can you offload, outsource, or just stop the things that aren't consistent? Because adaptogens are meant to help us adapt, but they're not meant to help us override a life that's in chaos. Right, exactly. And a lot of people think that that's what they're for. So we have to still do the life piece. But when it comes to picking adaptogens, I look at the realm of adaptogens and what different kind of energetic principles that they have or what actions they have in the body. So some adaptogens like ashwagandha, reishi mushroom, the other medicinal mushrooms, maca, holy basil even, they tend to be very gentle. They're not stimulating. They don't tend to agitate or keep you up. In fact, ashwagandha and reishi are great for sleep. So if someone's really burnt out and exhausted, I always say, if you have a car and there's no gas in the car, you can step on the pedal all day long, but the car is not going to go anywhere. You need to fill the gas tank up. And so while a lot of us get really tired and think, okay, well, let me take some ginseng. Let me take something that's going to pump me up. That's actually not productive. It's just like overloading the circuits. So I pretty much always say start with those really gentle adaptogens, especially if you're in that overwhelm. It's holiday season, kind of like the chill adaptogens. If you have a job, let's say you are a UPS driver, or let's say you're working crazy shifts at Amazon because your job is Amazon fulfillment and Amazon requires you to have flexible shifts, which means you may work on the weekend and we're at holiday time, right? So these are companies that are like super ramped up right now. And let's say you don't have the freedom to just say, yeah, I'm going to go to bed early. I'm not working the night shift. Then you might need a little bit more. Those gentle adaptogens are really great. And the medicinal mushrooms are amazing for immunity at this time of year also, especially with travel and exposure to cold and flu. They can be really great. But sometimes if you're in a situation where you do have to push a little harder and your life doesn't allow you the luxury of hitting the pause button, then some of the more stimulating, if you will, adaptogens can be really beneficial. Holy basil being one that can kind of edge in that direction for support. But then think about rhodiola, American ginseng, and even Chinese ginseng. Those are still very supporting, but definitely a little bit more, they give a little more oomph. They can definitely be stimulating. But if you're having sleep troubles, also err on the side of the softer ones, as I call them.
And then this is not related to burnout so much, but I think just as I get older, there are certain things that I see pop up in the population of women that I'm surrounded by. And I wondered if I could ask you about cysts and fibroids and why these things pop up and what women can do to help, relieve those symptoms.
Yeah. So one thing that's really important to look at is that we're in what I call a hidden hormone epidemic. And it's hidden because a lot of women aren't talking about these things with each other because they're embarrassed or don't know what it is or don't know the difference between is that normal or is it not normal, right? I don't know if it's supposed to hurt when I have sex or when I have my period, and menstrual cramps are normal. Everyone has them, right? So we don't always even know that something is not okay. And my bottom line to that is being a woman should never be painful. Being a woman should never hurt. I mean, labor, having a baby and pushing a baby out is pretty intense sensation, but short of that, it shouldn't hurt. So when you are having pain, it's definitely something's going on. If it's pain with sex, it could be vaginal dryness. It could be a history of trauma that's showing up and your body's talking to you that way. It could be vaginal infection causing a lot of irritation and inflammation down there. We want to look at, though, I want to step back and say, we want to look at the whole environment. So back to this hidden hormone epidemic, we're living in a time where we're having unprecedented exposures to environmental toxins, plastics, pharmaceuticals. I mean, even just 10 days of ibuprofen and other nonsteroidal anti-inflammatories has been shown to inhibit ovulation. So if you have period pain every month and you're taking ibuprofen for 5 days, and maybe you get migraines, so you're taking ibuprofen for another 5 days, but then you're struggling with fertility and the fertility doctor's saying, oh, you need Clomid or IVF, has anybody looked at the fact that you're taking ibuprofen all the time? We know, for example, that a couple of states have banned using BPA in shopping receipts and airline tickets. Why? Because the people who handle those the most, who give those out the most, are women. And just that exposure through our hands is enough to absorb into our skin and absorb systemically and not only affect our gynecologic health, but affect our ability to get pregnant and affect our baby's health. Stress, we know, has a huge impact on our reproductive health, on our gynecologic health, and our hormones. Microbiome, huge impact on our vaginal ecology, which can cause chronic pelvic inflammation and pelvic pain. We know now can contribute to endometriosis and fertility problems, can affect our mood. So we want to look at the whole picture. And you mentioned my next book. That's what it's all about. It's what's the whole picture, and how can we take simple steps in our lives to turn those around and really reclaim our health from these influences that aren't nurturing us. The other thing is that we don't always have enough of what we need to counterbalance those influences. So they do become allostatic load, right? So most women aren't getting enough of the magnesium, iodine, selenium, and the list goes on and on, B6, folate, that we need to keep our hormones in balance, to keep our mood healthy, to keep our reproductive organs healthy, our ovaries healthy, our uterus healthy. And even if you're not reproducing, your lady part's healthy. And so, as you mentioned earlier, we talked about sleep. We're on a chronic sleep deficit situation. So many women are not getting enough sleep. So these things don't counterbalance the overload. So we're under-supported and overloaded. And we end up seeing this manifest in different ways in different women. So let's say your family has a genetic predisposition to polycystic ovary syndrome or insulin resistance or diabetes. Those triggers may show up that way because the environment interacts with your genetics in that way. Let's say my family has a history of endometriosis. Maybe it shows up that way for me. So what can women do? The first thing is always, of course, if you're in pain or discomfort or at any kind of risk, address the symptoms that are happening, right in the moment. Then the next thing to do is a 2-part plan. And I really use this 2-part plan for all my patients coming to me for pretty much every different condition, or at least chronic condition, which is look at the root causes. How is your microbiome? How is your gut health? How is your sleep? Are you eating enough? Are you really getting the nutrients that you need on a daily basis? Are you able to detoxify well? What's your detoxification system like? Are you loved? Are you supported? Are you in connection with other people who elevate you and lift you up? What are the stressors in your life? Are you caring for elderly parents? Do you have a child who is a teenager struggling with depression, right? All these factors. So we look at this and then we try to find little things that we can do to support the areas that are most in need. And often I'll do that using a questionnaire. In my book, The Adrenal Thyroid Revolution, there are actually questionnaires that are applicable to way more than adrenal and thyroid that look at these different issues. And then also I provide very specific targeted solutions. So for example, with PCOS or endometriosis, we know that in those conditions, there's often too much estrogen. And that is usually coming from the environment through exposure to things like plastics that we heat up our food in, or water bottles, or cosmetics, or body lotions or shampoo, things like that. Or we're breathing them in or getting exposed to them in our workplace through cleaners that are used, other, products like that. So looking at how can I remove those things that might be aggravating or adding to the problem. And then what can I do to provide dietary support? So for example, we know that getting more fiber can help reduce that excess estrogen load in the body, help the body eliminate it more, making sure that the detoxification systems in the body are supported. So like the liver and also your ability to move things through your bowels by making sure that there are plenty of fruits and vegetables in the diet. So we know that a rainbow of fruits and vegetables in the diet, and it's not a fancy intervention, it's just increasing to like 6 or 8 servings a day, can make a huge difference in preventing or reversing some of these gynecologic conditions that we have, not just the symptoms, but actually reverse them. And, somebody might be listening and going, oh my gosh, 6 to 8 servings a day, that's so much. But if you think about it, if you have like a green drink or a smoothie with some, like a half an apple or some, half a cup of berries and a half a cup of greens, that's a couple of servings right there. If you have a salad for lunch with, a couple of cups of green lettuce, that's 2 servings right there. Then you grate a carrot, that's another serving. It actually, you can add it up and meet that pretty quickly. And then next level, there are so many wonderful herbs and supplements that women can use that are very targeted for whether it's ovarian cysts or whether it is PCOS or endometriosis or fertility challenges. One of my family members right now, I'm helping with an ovarian cyst. So it's really a matter of, okay, let's take out the dairy, because this woman was eating dairy every day. Organic dairy can be a very healthful food, but when you're struggling with a hormone problem, not so much. It can actually add, even if it's good quality organic dairy, it's going to have hormones from that mama cow or goat or sheep. So I say, let's take that out. There are some very specific dietary supplements, herbs that we added in just to support healing that ovarian cyst, reducing that estrogen, getting her cycle back on track. And, it's going great. So do this all the time, even for my own family members.
So typically, just hearing so much about cysts lately, you would say that that's excess estrogen is one of the causes.
There can be a number of different reasons for cysts. So one, you want to look at it, is it a cyst that's associated with PCOS? Are there multiple cysts? And there are lots of different kinds of cysts. So there are cysts that happen on the ovaries due to endometriosis. Those are called endometriomas or chocolate cysts. They're called chocolate cysts because the blood that congeals in them gets really dark. So it has that kind of dark chocolate look. So then you want to treat the endometriosis. Obviously, if it's super large or severe or causing damage to the ovary, there may be a time when surgical intervention is necessary, but that's very clear. Like it's over a certain size, gynecologists know what that is. And, you just make sure that you're not getting an unnecessary intervention. But yes, ovarian cysts can be caused by hormonal imbalances. So any number of different, kind of configurations of hormonal shifts can cause them. But a lot of times what's happening, so every month we are maturing a lot of different follicles, and each of those follicles has the opportunity to become an egg and to become an ovum that gets ovulated. In some women, they're going to build up multiple follicles, but for a variety of different reasons, if they're not ovulating, those don't get released. And so one or some of those can become bigger and bigger, and more fluid fills around that. And then there can be inflammation around it too. And if that follicle doesn't rupture, then it can become a actually substantially large cyst. So in most cases, if there's not endometriosis, it's often some form of not ovulating. And so then I want to look at, why is she not ovulating? Again, it could be PCOS. It could be that she's actually not getting enough calories. She's underweight and undernourished. And so she's having some cycling, but she's not really building up enough oomph to ovulate. It could be low estrogen sometimes in that case, because she's not having the fat to produce enough estrogen. We produce estrogen partly from our ovaries, partly from having enough cholesterol and fat. And there can be other reasons that she's just not ovulating. So it can be stress, for example, it's causing it. A low thyroid function can prevent ovulation. So I'll look at all of those different factors and try to get a sense of which it is for her. And then, proceed kind of like appropriately for that.
And how can looking after our microbiome and getting different types of fermented foods in our diet help with those hormonal issues? I tend to think of it as like leaky gut, but it also affects your hormones, right?
It does. So we have this really cool, the microbiome is so cool. I mean, I just like every day there's something I read. I'm like, wow, that's like, it's fascinating. These new levels. We actually have this whole micro community of our microbiome called the estrobolome. And it's because its entire job is to metabolize estrogen. And so it lives to basically take our estrogen and break it down into eliminatable forms. Some of it we reabsorb, which is great because we may need that extra estrogen, especially as we get into perimenopause. But some of it we excrete. So if the estrobolome isn't working properly, you can either be not breaking down enough estrogen and reabsorbing it. You can be breaking down some, but reabsorbing a kind that you're supposed to be eliminating, which is even more potent and potentially toxic. Or if your microbiome isn't working and helping you break it down at all, you may be just eliminating it and be low in estrogen. So the influence of the microbiome on our estrogen is profound. And if your estrogen is not, where it needs to be, that's going to also affect your other hormones down the road. So it's going to affect progesterone, whether you ovulate. So many different symptoms can be caused by too little or too much estrogen. A lot of women in our culture have too much estrogen because we're getting so much exposure there's so many endocrine disruptors in the environment. And so not being able to eliminate that effectively can lead to monthly breast pain, monthly breast lumps, really heavy periods. Really heavy periods tend to mean more painful periods because your uterus has to work harder to eliminate all that blood each cycle, eliminate that uterine lining. Big swings when you have really high estrogen and then it drops at your period throughout your menstrual cycle can cause migraines. Drops in big changes in estrogen can cause joint aches and pains and even autoimmune conditions. So the microbiome plays a really big role. The other thing is that the microbiome is responsible for producing a lot of our neurotransmitters, things like serotonin, which can affect our mood. That can also affect our food cravings, how much sugar we're eating, how much coffee we're drinking. The microbiome is tied into your sleep rhythms. So your microbiome can actually get jet lagged when you get jet lagged, but your microbiome, if you're not nourishing them well, can actually cause you to have circadian rhythm disruption. So it can actually affect your sleep. And that can have a huge effect on your melatonin. And we think of melatonin as what? A sleep chemical, right? A sleep nutrient. It's a neurohormone. But what a lot of us never learned is that one of the most important chemicals that we have in our body for ovarian health is actually melatonin. So if we're not producing enough melatonin because we're not sleeping well, whether it's because our microbiome is disrupted or something else, that can have a big impact, not just on whether you ovulate, but even on your ability to conceive and the health of that ovum and whether you can implant that fertilized egg into the uterine lining. So it's really interesting. So yeah.
So sleep is really important.
Sleep is really important. And microbiome health is critical. I was going to say it's so, in some ways it's so complex, but then the solutions are actually really simple, right? You don't have to necessarily take some crazy fancy probiotic product. You can actually just eat more fiber, eat some lacto-fermented foods in your diet, get good sleep, spend time outdoors. There are a lot of things that we can do that are really within our grasp and also that don't cost us more than just daily living.
So I just interviewed this woman who is like an expert in making sourdough bread. And
oh, wow, nice.
She was saying that we're actually more of the bacteria than we are actual human cells.
We are.
And I thought that was so interesting. So when you say we can just eat more fiber and lacto-fermented foods, what would be like the down and dirty, what you'd recommend to your patient of just like the simplest way to do that? Like, what do you mean by fiber?
6 to 8. So fiber is the part of plants and grains and beans. So plant-based food has a lot of fiber in it. Our ancestors, and I'm talking like when we talk about paleo diet, those ancestors got about 100 grams of fiber a day. We know that for human health, like just basically like things like preventing colon cancer, we need 30 grams a day. The average American is getting 15 grams or less a day. So we're not getting those whole food, plant-based sources in our diet. So simply getting up to that 6 or 8, or well, ideally 8 to 10, but 6 or 8 servings of leafy greens, fresh berries, those fibrous vegetables like carrots, celery, root vegetables, adding some whole grains. It can be millet, brown rice, buckwheat, and some of those are actually seeds. So even if you don't really tolerate grain that well, you can usually tolerate millet and buckwheat, for example. And I think people are so scared of grains and legumes and beans, but every study on them shows how much they improve hormonal health, fertility, heart health, blood pressure, cholesterol, mood, weight. But adding in, let's say, that 6 to 8 servings of veggies a day, making sure a couple of those servings are leafy greens like kale, collards, broccoli, bok choy, anything in that brassica family. 1 serving of whole grain a day if you don't tolerate grains very well. 2, if you really enjoy them and do well with them. So maybe like some quinoa for lunch and a little bit of brown rice for dinner. Or sourdough bread. Interestingly, a study came out this past year saying that even people with celiac disease may tolerate a good whole grain sourdough bread without a problem. Now, if you have celiac, I'm not encouraging you to eat gluten because it can be really problematic. But we've gotten so afraid of bread. But I think what we're so accustomed to, and I hear this all the time, even people I know who are very gluten intolerant, they'll go to Europe and they'll eat good local bread, sometimes sourdough, sometimes just like ancient grain. They don't have a problem. And it's not psychological. It's that we're not getting in our daily diet that good quality that we need. I am really fortunate to live about 10 minutes from the bakery that was actually the only bakery featured in Michael Pollan's video series called Cooked. And so sourdough bread is actually an almost daily part of my life. And you can make it. Yeah. I mean, it's so easy to make if you like making it, or there's so many wonderful bakeries now. And in fact, the one that is near me, Berkshire Mountain Bakery, which they don't pay me to say this, but they actually even do mail orders. They use ancient grains, local, organic, brick oven baked. It's amazing.
I just went to visit a family this past weekend, and I've been gluten intolerant, haven't had bread for years. They made sourdough bread. I ate so much bread. They gave me some culture. I came back. I made pizzas. I had how many pieces of pizza? And I feel thinner. It's
that's interesting. Yeah. Well, it's such good fiber that if you tolerate it, like we all have to listen to our bodies. And for some people, I mean, if it causes you bloating or constipation or aches and pains, then obviously it's not the right thing. But giving it a try, it really can provide us with such a basic staple.
One last question I had for you.
Yeah.
As we go into like the cold and flu season, as long as it's not like very serious, something that you would need antibiotics, what do you recommend to folks before getting to the point of taking antibiotics? What herbs or...
Yeah. So first of all, most cold and flus don't need antibiotics because they're viral. So only take an antibiotic if you have a bacterial infection that justifies it. And that's really important, not just for your own health, but for planetary antibiotic resistance. We need to be really thoughtful about that. My first go-to, if I get exposed to something, let's say I go visit my grandkids and they're both coughing and sneezing and sniffling and, sneezing, and then like everything comes out and they're like, I need a tissue, which has happened more than once. And I'm the one to be like, I'll usually just simplify my diet. My diet is pretty basically, healthy and simple, but I'll make sure that I'm more mindful about what I'm eating, pay more attention to eat at home instead of going out, because there's always, it's harder to eat as well going out. And I tend to warm up my diet. What I mean by that is I tend to take cold foods out of my diet, whether that's something straight from the refrigerator or more like, think about something like yogurt or cold fruit. And I'll tend to lean more toward almost like a macrobiotic type of diet. It's not macrobiotic, but it's like warm soups, grains and steamed vegetables, simple fish, simple chicken, things prepared lightly. And I'll do that for usually like a week. If I start to get any symptoms like a sniffle or that scratchy throat feeling you get, you're like, coming on to something, or just like you feel a little down or achy or temperature dysregulated, I'll go to one of a number of things. Pretty much my first personal go-to is always ginger tea. I love hot ginger tea.
Me too.
I just, so good, isn't it? I mean, just breathing in the fragrances is great for our sinuses. That essential oil is great for our respiratory passages. So even as you're preparing to, sip the tea, you're getting bathed in that essential oil. Ginger is antimicrobial. It's anti-inflammatory. It makes your tummy feel better. It helps with aches and pains. So I always have fresh ginger in my house. I keep a pretty good amount and I grate it on just like a microplane. And then I squeeze the juice into hot water. If I want like a quick down and dirty, add a little honey or lemon. If I'm a little more, taking a little more time, then I'll actually grate it on a box grater and put maybe like 2 inches worth of fresh grated ginger, like about 2 inches of the root, into about 2 cups of boiling water. Shut the water, put a lid on it, let it simmer for maybe like, not simmer, but like steep for about 10 minutes, 15 minutes, and then I strain it, again, lemon and honey. So that's a huge go-to for me. The other thing is I had a girlfriend staying at my house last winter, and she was pregnant, and she had to teach in front of like 300 people. People are going to get up. She's very well known. People were going to get up front and center, and it was right during cold and flu season, and she didn't want to get sick, and she was like 7 months pregnant. And so she showed up at my house with this pint mason jar with half the mason jar was filled with just fresh pressed ginger juice. And so I started making that last year. It was so delicious. She stayed at my house for the week she was teaching. And so we'd get up every morning and put some ginger juice into some water. It's also really good in sparkling water. It's great with a dash of maple syrup or a little bit of honey, and just have that as a morning go-to beverage throughout cold and flu season. Adaptogens, medicinal mushrooms are great. I love miso soup with, again, ginger and a little bit of fresh garlic pressed in it. And that's a big go-to for me. Those are kind of my things. I am not a huge vitamin supplement taker. But I might bone up a little bit on some vitamin D and some zinc if I've been exposed to someone like, again, I spent 3 nights at the grandkids and they're sick the whole time. I may come home and do that for a few days too.
That's great. Thank you so much. So last words of wisdom, something you find yourself commonly sharing with people, or just something that kind of springs organically as last words of wisdom?
I think giving ourselves permission to pause. I mean, it's something I have to remind myself on the regular because life tends to want to pull us along on a very fast ride in our culture. But especially with the holidays here, can get really overwhelming. Not everybody has a family of origin that it's always easy and lovely to go home to, but you still go home. It can get really stressful around presents and the economics of that and travel. And as women, especially, I think we tend to feel, we're programmed to be givers and to kind of take care of everyone and push ourselves. And I think that if we give ourselves permission to just stop, even if it's for 5 minutes when we're feeling just that edge of overwhelm, and then build in some longer times, like 15 minutes at the end of the day, half hour before bed, and then a little bit longer on your day off, like just 2 hours, where you can go from that expansion that the world requires, right? That connection, that intensity, to that place of restoration. We're meant to stretch and we're meant to rebound to where we are, and it can make a huge difference in our health. And it's really about giving ourselves permission. It's not just doing it, but it's giving ourselves that full permission to really take care of ourselves.
That's amazing. So for the listeners who want more of Aviva, you can visit Aviva Romm, that's ROMM.com. And the book, when can we expect the new book? In a year or so?
The Adrenal Thyroid Revolution is out, and that's just chock full of great stuff on taking care of yourself, really with just being a human being in this world. And definitely if you have adrenal or thyroid issues. And then the next book is right now scheduled to come out December 2020.
Ooh, exciting.
Yeah.
Okay. Well, happy writing for the last chapter.
Thank you. Thanks for having me on your show.
Thanks so much for taking the time, Aviva.
Great talking with you.
Thank you so much for listening to The Flower Lounge. I'm Katie Hess, and we'll be releasing a new podcast every Wednesday. If you like what you heard, or you know someone who might be touched by our conversation, share it with them. And don't forget to subscribe. To find out what your favorite flowers mean about you, take the quiz at LOTUSWEI.com.